Hi, this is Mina.
This is Tony.
Today we're just going to do a normal shoulder exam. We're going to do all the different maneuvers and all of the different things that I use to evaluate somebody's shoulder. And we might mention what might be abnormal if that test is positive, but for the most part we're just going to go through a normal exam. So what you're looking for is symmetric active forward elevation. Come on back down for me. Put your hands in front of you with your thumb down. So putting them in this position and pushing up against me. That's Job's maneuver, and that should be symmetric strength bilaterally. Palms up, push up against me. That's normal there. So if they have pain with this one or weakness with this one, called Job's maneuver, it's suggestive of a rotator cuff problem because it puts the arm in line with the supraspinatus. If the palm is up like this, it rotates the biceps tendon to be at the top of the shoulder and at the maximal point of pain. So if Job's maneuver is negative and biceps tendon Speed's test is positive, then it's suggestive more of a Speed's test, of a biceps tendonitis. If both of these are normal, I'll have them put their arm across their body like this, push up, and that's a modified O'Brien's test. That tells me that if the other two are normal and this one is painful, that in this position, the ball is pushing up at the top of the labrum, and they might have a slap tear, which we can diagnose clinically or with the help of an MR arthrogram. Push out against me here. This is the active external rotation strength. Put your hand on your belly, bring your elbow forward, push forward. That's a belly press test. Reach up behind your back, and that's internal rotation to the upper lumbar spine. Let me see your hand one more time. Is this tender here?
No.
So he has no tenderness over the AC joint. And any pain with this?
No.
So that's a negative cross-body adduction test. So if he has no pain with Job's maneuver, no pain with Speed's test, a negative O'Brien's, 5 out of 5 external rotation strength, a normal belly press test, internal rotation to the mid-lumbar spine or the upper lumbar spine, no tenderness over the AC joint, and no pain with cross-body adduction, that's essentially a normal shoulder exam. You can see the whole time I'm examining him, I've got my hand on his shoulder. I'm palpating up here for any sort of scapular dyskinesis. Some people advocate for taking off the shirt and examining the shoulder blade. I found that particularly with women, particularly with people coming to the office that don't feel like changing into a gown, having my hand on their shoulder blade for the entire exam helps me to assess whether their shoulder blade is hitching up, and that way it keeps them a little bit more comfortable not having to change into a gown. And it's kind of a sensitive test, not very specific, for scapular dyskinesis. The best practice is probably to have people change into a gown, and in different practices, people manage things differently. This is how I manage things in my practice. And if I find that the shoulder blade is hitching and I'm suspicious for a serratus palsy or a trapezius palsy or something else, I'll have somebody change into a gown and do a more focused exam on the shoulder blade if I think that it's appropriate. Thanks for tuning in.
Thank you.